morning, colleagues. If we may settle down, please, so we can begin our meeting. We will open our meeting with prayer or meditation. Thank you. The meeting is officially open. Good morning and compliments, colleagues. We'll try to speed up things a bit in the interest of time. We have an agenda that has been circulated and uploaded on SharePoint. You are all welcome to this meeting. The agenda before you has few supplementary agendas, but a total of about 11 reports as it may, so we should be able to just run through it quickly. I don't have anything before me in terms of leave of absence except the group head, who has indicated that she will be late in the office of the speaker. And then we also have the group head, Ms. Thandi Radebe from the CRM department, and the COO will also not be able to attend. So the last one is from Councillor Peter Sutton, who will join us a bit later, like 30 minutes into the meeting. Any other apology can also just be forwarded to the office as per the leave policy of the municipality and any other relevant regulation or procedure of the municipality. Colleagues, we'll move to agenda item number 3, which is the approval for the minutes of the previous meeting. This is the minutes for the committee meeting that would have taken place on the 7th of November 2025. Are there any corrections, comments? As recommended? Thank you. We'll go to agenda item number 4, which is matters arising from the previous minutes of the committee. Any comments? None. Thank you. We'll move to part number 5, which has 2 items under it, which is the Municipal Public Accounts Committee Process Plan for the 2025-2026 financial year. That is found on page 5 to page 22. The process plan is before you, colleagues. If there is anyone who wants to make comments on the process plan. Oh, yes. Yes, Councillor.
Thank you, Chair. Chair, just to get indication, the process plan and also the outstanding report also forms part of another report that's coming in later. So how do we do this? Do we deal with these reports now or later? Input. Do we make the input now or later?
Yeah, I think you can make your inputs, and then if for some reason they also feature later on, we'll note them as such. Thanks. Did you have any input, Councillor? Or
No, Chair, I will wait for the coming report, Chair.
Okay.
Yes, sir.
Any other comments on the process plan? As recommended? Thank you. Thanks, colleagues. We'll go to part 5, item 2, which is the MPEC outstanding reports. You will find that on page 23 to page 28. Yeah, so there was a typo there. I think the reports are outstanding as of today, not necessarily as of 7th of November. Yeah, so I don't know if you got a chance to have a look at the outstanding reports, colleagues. Yes, I'll start with Councillor Municipal.
Thank you very much, Chairperson, and compliments to the new season and greetings to all the colleagues. We read the report, and so we would like to do 2 recommendations additional into the report. I'm not sure you will then allow us to do that, or we will take hands for clarity seeking questions.
Just so that we're on the same page, Councillor, we are still on outstanding reports, right?
Yes, outstanding.
Okay, thank you. Yes. No.
Yes,
no
the
problem.
outstanding reports, because yes, we are on the outstanding reports, Chair. We remember in terms of the process plan, we have many outstanding reports. So even these ones from the 7th are in addition of the previous one. So we thought maybe if you can make a recommendation into speaking into this problem, perhaps this recommendation might be able to resolve the problem. We don't know.
Okay, that's fine. Maybe let's then entertain Councillor Sanfeng, and then you can come with a recommendation at the tail end, so just avoid a bit of confusion. Thanks.
Thank you, Chair. In terms of the outstanding report diagram table, number 11, it indicates the due date as 19 January 2026, but the required report was to be requested for the meeting of 6 February 2025. I'm not sure if that's a typo or what, Chair. Thank you.
No, it wouldn't be a typo, because I think the report will be due and then entertained in the next meeting. So then the date would have to follow the chronology.
Okay, so in essence, what you're saying, the 19th of January is the date in which your office should have received that.
Yes, the department should then report on it.
Thank you, Chair.
And then from there, then we entertain it in the meeting subsequent to that date. I think there are two hands, Councillor Marishani and Councillor Tsepo, then Councillor Mayor. Then we'll come back to you, Councillor Mabusela, for the recommendations that you wanted to pass. But let's start with Councillor Tsepo, Councillor Marishani, then Councillor Mayor.
Thanks, Chairperson.
Thank you.
I seek your advice on this one, because I feel like this part of our impact is on operational matters, whether the report has reached impact or not. And when we make a recommendation, are we making a recommendation to who on this matter? Or is something that operational we have to sit down, agree, and have an approach over it? Or are we saying this report is like a report going to council or what, and we are making a recommendation for council resolution? Or is something that we need to sit around and get to see operationally and operationally have an operational purpose and maybe consequence management and other things and agree on how we can approach things and have a way of dealing with it. And if somebody transgresses, and then that's when we'll be able to make a recommendation on how to deal with that person or that department. And I think that's where I need clarity on that one.
Yeah, thanks. Hence I said the councillor will speak at the tail end so that that's why also I did ask if we are was still on the same item, but I think we'll hear out from him and then we'll make a call quickly. But I think he still has that latitude to make his input. Councillor Marishani and then Councillor Mayor.
No, Chair, thank you very much. Compliments of the new season. In September, we compliment each other until March. So, those of you who are tired already, please bear with us. Chair, let's avoid discussing our issues in the meeting because we're going to derail the meeting. We've got lots of outstanding reports. My advice would then be, let's have a committee caucus, either through whips or all members, so that we package all these issues. And then we write to the relevant people, either the CM or different departments and so on, with the entire package. Because if you discuss this thing in front of, I'll give an example, the MSO, you are already telling him the approach for this year or the problems that we have. So let's run the course of this agenda meeting. And then let's have a separate meeting, raise all the issues in terms of the outstanding reports. Then we write to all the, and we even give deadlines as to when do we expect those reports. So I think that would be fair enough, and there wouldn't be anyone who even blame us, because we would have given them enough time for them to furnish us with all those reports. So that is the advice that I can give, because at this rate, our meeting is going to derail and we are going to end up going out of this meeting very late without achieving what we need to achieve.
Yeah, thanks. Councillor Mia.
Thank you, Chairperson. Also to all of you, yes, compliments of the season. I don't want to repeat what the other colleagues have said, but I'm very concerned, actually. It's quite alarming if you look at the outstanding reports. We must get to a recommendation and a solution that these reports must serve on time. Specifically, if you read it in context with the letter that we got from National Treasury as well, in terms of the effectiveness of the impact and our oversight. So I don't want to repeat what the others have said, just that as well. Read it in context with National Treasury's letter. Thanks.
Yeah, so I think we will come in just now, Councillor Mabusela, with just to finish up your point and tell us what is your take. But the concern is that there are many reports. And the due date has passed in several of these reports. There are departments that has requested extension in September, extension in October, but that extension was in relation to the meeting of November, I believe the 7th. It was in relation to the meeting that was to be held on the 7th of November. But we have a list that is growing and a list that is not being serviced as it may. And that's a concern I would summarize from the colleagues. We need to speed up this, and we need to understand why are the reports not being sent through by the departments, because we are anticipating a very busy year ahead of us. And now the problem is that we are already halfway through the financial year. So if the departments are not submitting reports, they are going to create a big problem for us, because then we have a backlog. So Councillor Councillor Mabusela, you wanted to chip in, but be cautioned, of course, of that approach, because we don't know how do we fit the recommendations into this, but also each case may be different. I mean, we have dates ranging. You are noted, Councillor, dates ranging from 17th of June request or calling of a report that was supposed to be handled by finance. Then you also have reports that were requested recently on the 19th, reports that were requested in October, and then the complexity of the reports and so on. And then you also have departments that don't even bother to write to our office to explain exactly why they're not able to furnish us with the report. So, Councillor Maklo will speak, and then Councillor Mabusela will just chip in, and let's speed up the process. Thank you.
Thanks, Chairperson. Yeah, mine is just really in terms of these reports that are still missing. From number 11 until number 16, I think there's a sort of a mistake in terms of the year, because I think the Secretariat kept on saying 2025 instead of 2026, especially in terms of today's meeting. 16 January 2025, I think it was supposed to be 16 January 2026. I don't know, but they can maybe explain why the continuous January 2025. I think it's a mistake.
Is on which reports, Councillor? Sorry? Report number?
I think it's report number from number 11 to number 16.
You are referring to the date on the column? Oh, yes, yes. No, it's a typo. The Secretariat will fix it. Thank you. All right. Councillor Mabusela?
No, thanks very much. We are not rigid. We are open for persuasion, and we understand that the recommendations that we want to provide are also operational, are responding to operational challenges that we are facing. But we can sit down and with the colleagues and see how we can resolve them. But also, we think that this recommendation, for them to be able to be binding, they need to be maybe be provided in our terms of reference. One of the critical elements that Councillor Marishane spoke about is time frame, and one of the recommendations wanted to speak about attaching the time frame on the requested reports, because there is no time frame, but also deal with the issue, Chair, of the extension. We are receiving letters here requesting for the extension, but on top of that, we don't know for how long we should grant the extension to the departments. So we are humbly requesting that let's look into this matter, because currently it's not even operational, it's not binding. Let's perhaps, when we review our terms of reference, let's include this recommendation so that they can be binding. We can then withhold them for now up until we have the discussions. Thank you, Chair.
Yeah, no, thank you. Your suggestion, Councillor Marshall, do you want us to carry it out now, Deputy Chief Whip? Okay, but I think the long and short, colleagues from the departments, those who have requested extensions, and those who did not request the extensions, is that we need the reports to come through, because we are already halfway through the financial year. There are certain reports that are not as complicated and should not be taken this long. And then you cannot write to the committee and request an extension without a clear timeline as to until when. Then you can't request an extension for a number of times, multiple times, without a clear reason exactly why you requested the extension. And then the reports should also then be compliant in terms of they must go through the C9 chain and want the problems. And when we get the reports again, let them be in a quality that is befitting. So we don't have that situation that we've previously had. And then I think then my office will be engaging with the different departments. But if then again we come to this kind of a meeting next month, and then this list is not exhausted, then we have to start passing those recommendations. And there is an item, Councillor Mabusela and the colleagues here that deals with the terms of reference. And if you do feel indeed that there is some amendment that needs to be done, we have that item coming, so you might as well start preparing that in writing as it may, so that it forms part and parcel of that part of the report. But in the meantime, let us please pull our socks and ensure that all these reports that are due, they actually get submitted on time to our office, so that we can start the process of entertaining them before the crazy and busy period comes, where councillors may not be always available and may create a bit of a challenge here and there. So, and also we have an issue, of course, of time, because we're midway now. So I think we'll close that item with those remarks, if it's acceptable, colleagues, without trying to waste more time. Thank you. Colleagues, we'll then move to item 6, which is matters for consideration. Under that, we have report 1, report 2, report 3, and then we'll then skip report 4, then move on to other reports, then we'll then entertain the minutes, we'll then entertain the cooling of the reports, then we'll break, go in committee, and so on, then start entertaining the reports that are in committee. The other one, colleagues, is that there's a bit of a concern, I think also it arises for myself, that we should try and limit the amount that we use to engage per report, and that we should at least try to restrict that a speaker should speak once in a report. And whenever you're endorsing someone's view, let's just endorse it and move on. The chair will also be mindful of opening of the reports and deliberating on them, as well as repetition in terms of talking. So let us try to be mindful of time as we engage. Colleagues, we have before us a report from the Department of Health, which is a report on community-oriented substance use program, COSAP, of the City of Tshwane in partnership with the University of Pretoria. The report is found on page 29 to page 52, with recommendations on page 52. Is there any deliberations on the report? Thank you. We will start with you, Councillor Randall, Councillor Matlow, and then you will follow me. Councillor Randall?
Thank you, Chairperson. The report, there's just a few things that I need to highlight here. Is the concern about the budget reductions that's due to realistic revenue performance. So are we going to push through and try and keep this initiative alive? Not that there's nothing about I'm against this. It's a very crucial and much needed initiative. But the reality is giving us another picture in terms of dwindling budgets year after year after year. So that's a main concern. The new SLA, can we maybe just get a feeling of if there's any core changes from where it initiated from to where we are today, with specific mention in the budget that's been reduced and how has it been impacting on certain programs that can or can't be rolled out going forward. And then my other question, the joint working group, I got the feeling that it was indeed established, But can we just get a feel of how it has been performing? When last was a review and approval of the implementation plans done? And who are the members currently of this joint working group? And then lastly, there was mention made that the University of Pretoria would establish a consortium with other institutions of higher learning. And one would want to know, if that indeed happened. And tell us about your successes and the stories. We see, we can go to a taxi rank and we can dish out 100,000 flyers. Does that equate to rehabilitating a drug user? So I just need to know. Give us an example of a success story in terms of COSUP. Thank you.
Thank you, Chair. Good morning, colleagues. I will allow DH Namutenga just to respond to the comments and the questions raised. Thank you.
Yeah, thank you, Group Head, and thank you, Chairperson. Good morning to all councillors and colleagues in the meeting. Looking at the comments and questions, the issue of budget reductions indeed has been a reality since the establishment of the program. But the way we plan with the University of Pretoria is that we look at what has been allocated and then be able to align to what we need to be able to achieve. If I'm to link that with the impacts of that on our deliverables, in terms of what the numbers that we deliver on, there has not been much of an impact because we actually get support from other institutions also that are linked to the university in terms of other deliverables. But in terms of the numbers as reflected in the report, in terms of our performance, it has been consistent and we have been able to deliver what we are supposed to deliver on in terms of this program. And that, if I link it to the question on success stories, in the report, there is attachments there that are annexures, and part of annexures from H, I, and J, and also actually starting from G. Those are reports that reflects the impact of the program and some of the experiences that are felt by the communities as reflected on Annexure H, which is stakeholder perceptions in terms of how people see the program, and a research project there on number I, and Annexure I and Annexure J. So the details are there. What we can reflect on as a success factor is mostly sometimes people want to say, have we counted maybe thousands and thousands of people that we have been able to get off the substance. What we say is that we have been able to make people to be more effective and participate in the normal life of economically being active. If maybe the person was no longer doing schooling, the person being able to do the schooling because of the interventions that we are making. So those things are reflected in those annexures in detail there. So many a times people say, what is the reflection of success? And that's why we've consulted, we've made those reports there that I'm referring to from G to J, because we want to reflect on what does it mean to provide this type of service to the people. One important element also that we have always said is that for us, it is important to have a service available. If you look across the country, we are just one of the few, if not the only one, that makes the service available to its community, funded by government. Other institutions are starting, or other municipalities are starting, but the extent to which we have gone, not many have reached our pace. So we have always said that it is important that when somebody, a parent, calls out for help, we have got somewhere where we can refer them to. And that's what we are doing. And when we get a question that says, what is the success, we refer them to those type of arrangements. On the joint working group, it is working. We meet on a quarterly basis. We met in the last quarter. We do have the records of what we have discussed. We go through an agenda there, which includes the performance review and any emerging issues that are happening in the program and things that are happening broadly in the space of substance abuse response. So we deal with those things. And we are now looking at going into the new phase, and that is part of what we discussed at the joint working group, because this service level agreement expires on the 31st of December. And as a result, we have already started looking at the way forward. The working together with other institutions, indeed the University of Pretoria and us had discussed that the university need to extend a hand as the one that has started this initiative together with us. And with that, we have been able to work also with Sifako Mahato in terms of them contributing in other areas, like one of the service points that we have in Hamaskra at Sitero Sutreka Clinic. There we work with the doctors from Sifako Mahato. And also we are now actively engaging them for the future program, for them to have a detailed input. We've had meetings with them in December, and we are going to continue to have meetings with them so that the new approach can include the other institutions based on their specialization. And that will include the University of South Africa and TUT. I think I've touched on all the questions.
Thank you very much. There was a hand of Ntate Matlo first, then Ntate Madonzela, then Sepo, Ntate Kapa.
Okay, thanks again, Chairperson. Yeah, my question to the divisional head here is really in terms of the impact. I think it was asked, but I don't want to repeat it. I just want to ask something on page 38 about the statistics, really, the target, the key performance areas, about 120,000 people. That target that was achieved, overachieved, 144,000 was achieved. Are these people the drug users or just ordinary members of the public that were reached in terms of the program? Because on the ground, really, the statistics shows that drug usage is increasing, it's escalating. It's not going down. Families have been devastated by this thing, but here we see the good statistics that are being achieved. I just want to know this high number of achievement. Is that for users or ordinary members of the public? Thanks.
Yeah, thanks. Ntate Madonzela.
Yeah, no, thanks, Chairperson. Compliments of the new season. I think I'll speak on behalf of forward councillors, particularly in Mamelodi. We don't have a feel of this project. And it's quite surprising that it started in 2017 from the first MOU, then it moved over to 2022 up to date. And I see in terms of Region 6, they've got a stop center in Lusaka. But I can safely say out of 14 wards in Mamelodi, even the ward councillor in Ward 10, that is in Lusaka, doesn't have a feel of this kind of a project on the ground because of in Mamelodi West, we've got Mamelodi West, the hostels, where is a drug den for the users, and we don't see any activity from University of Pretoria vis-a-vis the budget that has been budgeted over the years. So I can simply say that we don't have a feel of this kind of a memorandum in terms of what is happening currently in our world. So I'm having a challenge maybe I'm putting up a challenge to the directors to say, up to so far, there's nothing tangible that we are getting in terms of the amount budgeted and the physical interaction that needs to be there in terms of our studies. Because of, if you can see, check on the report itself, there are certain stakeholders that are involved with the project, but we don't see them. And eventually, or maybe equally so, we've got a number of stakeholders that we are dealing with them at the white base. We've got a project from various stakeholders that are dealing with drugs on a day-to-day basis. And we don't see University of Pretoria or the department coming up with this kind of programs to those stakeholders. So speaking from maybe representing those wards in Mamelodi, we don't have a feel of this kind of a program since the inception. But I can simply say, when we started also as ward councillors from 2021 up to date, we're still having a very serious problem with the scourge of drugs within our area. And we don't feel this COSAP as a part of a solution that was designed in terms of the memorandum of understanding from 2017 up to date. Thank you.
Thank you. Councillor Katlin?
Yes, thanks. I'll be very short. As MPEC, we increase money. We want to check if you have value for money. And my first question is that, what are we buying here? Are we buying coping mechanism or awareness? Or are we buying rehabilitation? Are we buying youth moving from drugs? Are we buying the research? Do we have the research outcomes every year that as a city can read and say, this is a research report for drugs and how it works and everything, the growth and what. What are we by every year? If we spend 31 million, what are you getting out of it? And it's important that we get such an answer. And there's a social department is a part of the review committee. I'd like to hear from them that are we getting value for money? Is social department happy with the partnership that we have? Are the social issues being resolved by this partnership? And that's what we need to hear as MPEC. We want to know value for money. What are we buying? Are we getting exactly what we're paying for the price that we're getting for? Or maybe we should have used this money for alternatives, make sure that the young people are employed and what, and then underlying issues. Maybe we could have done EPPWP for that amount of money and make sure that they don't go to drugs because of they can afford other things that drives them to drugs. But I'm saying that we want to know if we're getting value for money. Thanks a lot.
Yeah, the department would have to respond. Okay, you can chip in, Councillor, as they are preparing the response.
Thank you, Chair. Just to get indication, what do we mean by users on opioid substitutions therapy, and what is the long-term consequence of that financially, or what consequence does it have when the budget is being reduced annually? Thank you, Chair.
Thank you. You can chip in, ADH.
Okay, thank you very much, councillors. I'll start with the issue of number of people reached. I think the councillor made reference to page 38. Maybe I must also first go to page 32. On page 32, there we reflect on the type of service we are providing. In the Act, which is called Prevention of and Treatment of for Substance Abuse Act, there is a reflection on the type of services to be provided. One of them is called community-based services. And this is what the city of Tshwane is focusing on. And then there's a reflection there from A to F in terms of what constitute community-based services. And the first one says include community-based treatment programs. So treatment program. I will link that to the question on what the councillor has reflected on opioid substitution therapy. So the treatment program, as referenced there, is reflected on section 33, 36, and 39 of the Act. But it will include the psychosocial support and treatment, the direct treatment in terms of medication, which is what we call opioid substitution therapy. So this is a therapy to replace the opioids because the substances being used are more the opioids. And then on the other side, with those that don't use that are using other things other than the opioids, which means we also treat them accordingly. And we do have clinicians that deals with the treatment. So I've touched on the opioid substitution therapy. It means giving somebody medication. And that medication is called methadone. There are different types of medicines, but in this instance, we are using methadone. So when we give somebody methadone, it means that that person is no longer using the substances, but that which that person wants from the substance is now replaced by methadone, and that person now starts to operate in a what we will say normal way, or the way that is effective. It's no longer the person that will want to go run around and do all these other things. If that person can be able to go to work, then we'll start to go to work. If he has to go to school, we'll start to go to school. That's what we give. So that is the replacement of what the person would have wanted on the other side. And then we say establish or utilize existing facilities and infrastructure, including primary health care centers, to provide integrated community-based treatment programs. So that is why we have our COSAP service sites. And also, that's why we have services in our clinics where people can go and get the treatment. Because people who use substances are also affected by many other ailments. And then it says it consists of multidisciplinary teams. Social workers, they are part of the team. Professional nurse is what I've just referred to about clinicians. And then professional and lay support as reflected on B. And all the other things there, F and E and F. So that's the services that we're providing. It will link to the answer to saying, what are we buying? And then, but also what are we buying will be linked to what I've reflected there on the table on page 38. And if I'm to go to direct answer to the question by Councillor Matfo. So the number of people reached is not the number of people treated. These are the people that we have reached because the interventions on substance abuse response are not necessarily only about treatment. So even educating somebody to avoid those people entering into the space is still the work that we have to do. So those are the numbers of people we have reached. It includes those we have treated and those that we have educated. And that is called prevention. the number of people we have screened, so these indicators are in line with the National Drug Master Plan. Those deliverables is what the National Drug Master Plan expects us to deliver on. And if you look at this table, it says key deliverables. That's what the National Drug Master Plan says we must do. And the key indicators, those indicators is what the National Drug Master Plan says we must do. There are many others that we have left out that are not necessarily the responsibility of the municipality, that are of the other institutions. And we have selected these ones that are relevant for us. So this table reflects what we are buying. And the faces themselves of people and the lives changed is what we are buying. We are also buying availability of service. The issue of not having a feel, I think it's an experience of the councillor and maybe councillors, as reflected by the councillor. And I suppose the thing we can do is to get the councillors to have the feel through engagement with them, so that we can show what we are doing, what type of services are available, and maybe also make the councillors to have an interaction with the services that we are providing and with the people that are touched by the services. And there was a specific councillor mentioned, the councillor for Ward 10. We are open to engaging all councillors. I suppose the councillor in Ward 10 could still have to come across the service in terms of interacting with it, since the councillor is new. But we are open to engaging the councillors, and we are also open to listen to the suggestions from the councillors in terms of what can the department do more, and what other stakeholders, like what the councillor has reflected, we can work with and interact with to extend the reach. Indeed, the sketch is continuing. The municipality by itself will not be able to stop the sketch. The things that leads to the substance use goes beyond what the municipality is doing. Recently, councillors would have come across the program by the province, where the Premier had announced sort of an open day where users went to certain areas, designated areas for assessments and even to be taken. If councillors interacted with that, we would have seen how deep the situation is and the challenges that faced the very same initiative, and the roles that our team have played there. Being in that type of a space, you would have recognized the level of withdrawals that users face when they are in a space where they can't use their things, and the interventions they require, and then the service that we have provided through our doctors and our clinicians. So I acknowledge that the challenge is huge. So far, we have not been able to touch everyone. But the numbers are there of those that we've been able to touch. Value for money, I think I've reflected on the value for money, indicating the numbers is reflected there, and the availability of the service, the lives that we have changed. We can take the oversight committee to the sites for the oversight committee to see for itself. We have been interacting with the oversight committee on this side of health over the years, and they happen to appreciate what they see when they get to the space. And when they start to interact with the program, they realize the benefits. The research papers, there are quite a number of them. They are there. We have a research portal that takes the research papers from the university and consolidate them into the database of research papers within the city. We can provide the link to the oversight committee for the councillors to see for themselves the outputs we are having. And like I've indicated, if you look at annexes G, H, I, and J, those are some of the research papers that we have been able to deliver. But there are many. Like I've indicated, we can provide that link and the database of research outputs for access by councillors. Yeah, I think I've responded to all questions.
Yeah. No, thank you very much, Doc. We've received your response in relation to that. I see the heads are popping up. But you must try and shorten your answers, Doc, because we are running against time. We would appreciate if you can just become, I know it was a bit loaded, because I think about 4 councillors asked the questions, but we'll take the last round. Colleagues, Councillor Zela. Councillor Mabusela, and then Councillor Senfeng. And then I will finish with the Deputy Chief Whip, Councillor Marshani. Let's try and keep it short, gentlemen. Thank you.
No, thank you, Chairperson. I think it's a good advice from the decisional head. We'll go to the ground, because what is on paper and what is explained, he has just explained, there are 2 different things. You know, when a person explains too long, he thinks that we can't hear. So I'm saying we'll go to the ground and check for ourselves, because what is on paper, I can tell you, is totally different. Nothing is happening. I'm a ward councillor, by the way. Nothing is happening on the ground. It's just that we can't prove it now, but we'll prove it during oversight. We'll do our own oversight and check what he's saying. Thank you.
Yeah, thank you, Councillor Mabusela.
Thank you, Chair. Just to, according to what I'm listening here, Chair, is that a huge chunk of money goes to research. We are paying a huge chunk of money for the university to do a research and produce the research papers, the research outcomes. And like he said, that there are a lot of article research peer-reviewed in terms of this issue. Then the question is that in terms of our organizational structure, we don't have maybe capacity to capacitate our individual to do such research on behalf of your department, even if it's your colleagues, or maybe you can work with group human resource so that we can conduct those research on our behalf. It might be less, but the second suggestion is that we have the NGOs. I think you have the NGOs or the NPOs that you are working with that are on the database. Some of them we are also even supporting them. Perhaps we need to look in terms of service level agreement to use those NGOs and NPOs to partner so that with them in ensuring that they can assist us to deal with this drug abuse problem, rather than only working with the institution of higher learning. Of course, they can assist us with knowledge production, but when it comes to reducing the drugs abuse implementation, let's work with these NPOs and NGOs because they are already on our database and we are working with them. Thank you, Chair.
Thank you, Councillor Senfe. Quickly.
Thank you, Chair. Just want to find out, the replacement therapy, is it a permanent thing? If not, what's the duration of the replacement therapy? Thank you, Chair.
Thank you. Deputy Chief Whip.
Well, thanks, Chair. Divisional head, clearly we are not impressed. The problem with government, it's a, sweetheart approach on a very serious issue. And hence we are not impressed. The unfortunate part is that from our side, this committee has got more ward councillors than peer councillors. And we are giving you the realistic, practical challenges on the ground. That which you are giving us is good for people who are doing their PhDs and all those things. They can use these strategies, their research. But in as far as the practical situation on the ground, you have missed the boat. I can challenge you. Take 15 million of this 80 million budget. Give it to Tandanani. Yeah. We'll show you what we can do together working with them. But in as far as your strategy, we're failing. I would want to urge you to go back to the drawing board and review your strategy. I don't want to go to the ground with you. You are just going to embarrass us. I don't want to be embarrassed. I'm saying to you, take 15 million and give it to Tandanani. You will see what must be done in as far as drug abuse is concerned. Here, you are just misdirected. We are just wasting money that we don't have. So we're not impressed. Go back to the drawing board. Give us something tangible. In this city, when we've got a problem of overload, we go and remove illegal connections. We must be robust. When you owe us, we go out there to an area, finish and clap. We've collected 4 billion. Success. We've got a problem of drug abuse. Let's be robust in approach. Mobilize key relevant stakeholders and deal with these issues. This one, it's not going to take us anywhere. It's not going to take us anywhere. So go back to the drawing board, come back to us with something tangible. Don't waste this money, by the way, because we're going to take you head on. We're going to monitor this thing. Don't waste this money. Try to find means to use it effectively. But in as far as what you've just presented to us, no, it's not going to work.
Thank you, Deputy Chief Whip. Almost called you acting speaker. ADH, we have a problem, and I think if you listening to the councillors here, as you are preparing your responses, that the program, it's a backstop program. And the problem you see when you're a drug user, mostly you don't want to see anything that has metal in it. Wakadisha, you sell that thing. So we are saying enough with research, more with visibility, implementation, and collaboration with the NGOs that are already doing the work on the ground. NGOs that are community-based program, community-based NGOs that are focused in the space in question. But then collaboration with the ward councillors, because the ward councillors would understand exactly what then is happening within their parameters. Because then if even where you've got your stations, the ward councillors would then not recognize and feel your presence, it means there's a problem. Imagine where you don't have a station, then it's worse. The approach must change, but we are a committee, Deputy Chief Whip, and a committee should take resolutions. And when you get a report and it says we take cognizance of the report, then we pass it on, we are still not helping ourselves in the process. And I would encourage that if the colleagues wants to pass recommendations then, or for anything to change, they would have to want to, or they would rather than pass recommendations. Because deliberations, we've had them. I think unilaterally all parties are saying, good, we see everything. Yes, you may have given someone a pamphlet and told them how bad drugs are. But the impact will be felt if someone really, one does not, and or someone who was already addicted no longer forms part and parcel of that group of the addicted people and then is cleaned. I think that's where the biggest problem would be. So I think we can't have research that has been going on for 10 years, almost 10 years, without any real tangible results. Outreach is good. We see your targets, they look beautiful in terms of outreach and so on. But we don't see it. We as councillors, by the way, many councillors were surprised when this report was called to say, hey, there's something called COSAP. Because even as councillors were not exposed to that program. Because maybe it's because the program is outsourced and ran primarily by University of Pretoria, so it becomes an academic exercise. And they may not appreciate the importance of the councillors. Maybe we must bring it back to the people so that the people can collaborate amongst themselves, people who are overburdened by the drugs and are bearing the consequences of those who are addicted to drugs and drug abuse. I think we should strongly consider bringing back that program back to the city. Institutions will always do research. There will always be funding for research. And then in that process, you will collaborate with them at that level. But to take the budget of the people and give it to an academic institutions that ordinarily have a surplus to do that work in any case, it does not assist us. I think we should strongly consider that as we are budgeting going forward, let it come back. Let it collaborate with our councillors. Let it touch our people. It may not touch everyone, but at least there must be one councillor who can vouch that they once interacted with the program and they know someone who got help from it. And I think we should move like that. Councillor Tsepo, I don't know if you are preparing recommendations, colleagues, if there are any. Otherwise, we must pass.
Chairperson, we request a 2 minutes caucus.
I'll grant you 5. Thank you. Thank you, colleagues. If we may settle down in the interest of time. Yeah, thank you. We still have quorum. You see, Councillor Matlu took a bathroom break, but we can still proceed, colleagues. Yes, Councillor Simfeng, is it Councillor Simfeng or Councillor Tsepo? Okay, yes, Councillor Simfeng.
Thank you, Chair. Chair, we've managed to come up with the recommendation, and the recommendation reads as follows. A report be presented in the next MPEG meeting with a feasibility study on determining whether it's possible to use internal capacity to provide same services in partnership with local NPO and NGO NPOs across all regions, proposed by myself, Councillor Karabo Simfeng, seconded by Councillor Tsepo Katle. Thank you, Chair.
Thank you. Secretariat will assist. Thank you very much. I have here before me the recommendations, which is an additional recommendation on top of the existing one. As recommendation number 2 is that a report be presented in the next MPEG meeting with a feasibility study on determining whether it is possible to use an internal capacity to provide for the same services in partnership with the local NGOs, NPOs across all the regions. The proposer of these recommendations is Councillor Garabo Simpe. Seconder is Councillor Tsepo Khatle. As recommended. Thank you. Thank you, colleagues. We'll then move on to report number 2. It's under part 6. Which is from the Energy and Electricity Department, the progress report on the installation of electricity management devices to indigent and amnesty approved accounts. The report is on page 53 to page 63 with recommendations on page 63. There is a hand from the MSO, and then I'll come to you now, Councillor Mayor. Yes, MSO?
Chair, my apologies, man. I had my hand up just before you wrapped up the recommendation.
Okay.
Just a slight concern on my part, because I'm not sure whether the time frames meant that the feasibility study will be conducted in 2 weeks that you were referring to.
Councillor Simfe?
Chair, in the next meeting, Chair, I guess we can get indication, a report indicating the duration on how long the feasibility study will take, but at least we have something in the next meeting, Chair. Then we can take it from there.
Okay. So, MSO, in essence, I think please bear with us, especially for the sake of the records. We note your concern in terms of time frame. But what we can do, MSO, is that we can agree that if you are not ready, it will be understandable. But at least you will be ready to tell us what sort of time frames you need. So that will feature on the outstanding, but it will take cognizance that you had only been given about 2 weeks. And of course, you have a week that is busy. The next week would, of course, be the week where we are preparing for council and so on. So there's not a big problem. But again, to withdraw a recommendation when it's already passed. it may not assist the records, but will pardon you should it not be ready in the department as it may. But we note your concern. Yes, Councillor Tsepo?
Yes, Chairperson. I would like to second my fellow councillor here. Let's have something. We want to know that something is happening. Because if we keep on saying that it will take 5, we can reach December, waiting for the same implementation. So let them give us something, update to say that this is what has happened in trying to get to a level of what we have requested. That's how far we are. Should be a progress report. If they have not yet concluded, at least they should come with a progress report. That's how far we are. And we think in the next impact meeting, we are this far until we get the completion of everything. Thanks a lot.
Yeah. Look, in the interest of proper running of the meeting, no way we can withdraw a recommendation that has already been passed. But again, I think my team here, please try and, if they have a blind spot, be able to indicate if there is a hand that is raised, so those kind of issues can be addressed before a recommendation is passed. But it's gone, it's gone. But at least on the next meeting, we should have something that we can refer back to and say, this is the issue, even if it's not the actual report itself, feasibility report, but rather a time frame that, okay, this is where we're sitting. Then that will still suffice. Organizational memory will protect you. It's so far as the point that you are raising. Councillor Mayor, you had your hand up. No, or is it on the report in question? Okay, so the report that we are entertaining now is Energy and Electricity Department between page 53 and 63 with recommendations on page 63. Councillor Mayor?
Thank you, Chairperson. Chairperson, I've got a problem with the quality and the correctness of this report. If you look at page 55 of the report on the table, the figures that are given to us here, really I would like the officials just to put spaces between millions and thousands and this or that. It makes it very difficult for us to configure if it's a million that we're talking about or 100,000 or whatever. That's just in general. Then on number of registered indigents, I believe an indigent is a person. On that as well, they use decimals. Luckily, these decimals end up with double zero, because it could be 93,607.1 indigents. I would like to see a 0.1 indigent. So can they please, it's serious. It's to me, this is disrespectful. Let's get proper reports before us. Then also, more problematic to me is how can the number of indigents, registered indigents, from July to August they increased, then to September they've decreased. Same with the consumers receiving free basic electricity. They start on decreasing.
Sorry, Councillor, as you are referring to the issue, it's better to refer to table numbers so everyone can follow. Because if you...
Sorry.
Yeah, you may be running ahead of
Chairperson,
us.
yes, I said on page 55, but it's table 4. Yeah, sorry, it's table 4. So I hope everybody is on the same page as me and on the same table as I am. So it's table 4. I'm referring to that one. And then
Thank you.
Then you'll see on page 56, I've got a problem, because in table 4, you see at September the percentage. There's a 42.6%, and then you've got a Z in 1 between brackets. And if you turn to page 56, you will see what that Z in 1 stands for. The variance has to be explained. Okay, thank you. The variance has to be explained. I can't see any explanation. So how can we deal with this report if it's not complete? I mean, this really is important. We need an explanation on the figures provided to us and why there's a decrease. So if you look at the recommendation, we say we must take cognizance of the progress made. I can only take cognizance with the information that I've got in front of me of the regress being made. Thank you, Chairperson.
Yeah, thank you. I will start with Councillor Matlow, then Councillor Sinfen, then Councillor Randall. We'll end with Councillor Zilla.
Okay, thanks, Chairperson. No, my concern here is really in terms of the report. There's an indication here that there's a lot of, there's a high number of people refusing to be allocated prepaid meters. They don't want prepaid meters. They are refusing. There's a lot of intimidation. And my question is really to the department, because this is a higher number. People don't want to pay in terms of prepaid. I don't know why, because they are one indigent program. I don't know why. But my question to the department is really, what are they doing? Is there any strategy in terms of what they can do concerning this high number of people who don't want prepaid meters? Is there any strategy? What can we expect from them? Thanks.
Thank you, Councillor Matlow. Councillor Sinfen.
Thank you, Chair. Chair, I would like to get an explanation. What would cause an indigent resident with prepaid meter and have no account number? In that instance, what would cause that? And also, what would be maybe the most common factors where people are requesting amnesty and they've got such high debts? For example, in Table 7, Soshanguve, people owe like millions or over 100,000. What contributes to that? Would that be a leaking pipe or burst pipe or over usage? Normally, what would be the factors that attributes to that? Thank you, Chair.
Councillor Randall.
Thank you so much, Chair. Yes, I just also want to confirm on page 55, we speak about a national cut-off date, 30 November 25, extended to 31st May 25. I think it should be 26, if we can just get that corrected. Then, Chair, in terms of the ESCOM supplied indigents, we see it's a much smaller number, 28,000, but I'm curious to find out, in terms of the invoices that we receive from ESCOM, what is our average monthly invoice that we receive, and has it been paid up to date? Chairperson, then, the tampering fee of 31,000 Rand, it's a council-approved fine. So yes, we can, during an amnesty period, we can maybe write off or waive a portion of the penalty or the fee. So what I want to know is how much money that is forgone because we've written off portions of the tampering fee. Because if you tampered with a meter, you need to pay the tampering fee. So how much revenue has been forgone? And or is there a portion that's been written off? Maybe an indication of what the figures are that we're looking at in this case. And then the target date for the completion of all amnesty debt relief approved residents will be March this year. Are we still on track? Maybe just an indication. Thank you.
Thank you. Councillor Zilla, you're the last one.
No, thank you, Chair. Chair, I see on the report it says areas within ESCOM supply like Magopan, Harangua, Winterfeld, Hamaskar, and I receive their free basic from ESCOM. So I wanted to check if the city does a follow-up on this one, because ESCOM says they know nothing about this. So I wanted to check who's following who between the two, Chair. Because community members who stay in these areas, they don't get these benefits, I can assure you. Or if they get them, I don't know how, Chairperson. So I wanted to check with the officials if they can prove it, or do they have, do they do a follow-up on what is written here? Thanks.
Thank you. I will give it to the department.
Thank you very much, Chairperson. The ADH Sibada will take majority of the question, but on the question of the monies forgone, we will request that that question maybe be attempted from finance. On the issue of the fluctuating numbers of indigents, we will also request that that question be attempted from CSD, but then we will take majority of the question through ADH Sibada. ADH?
Proceed, ADH. Thank you.
Thank you. Good day, everyone in the meeting. With regard to question number 1, we start on table number 4. I think I have to apologize. ZN was a comment which was not supposed to be there. So it has nothing to do with the report. And in terms of how the report is structured, the first one will have a commas because it's energy, which is measured in kilowatt hour. The second row is the number of registered indigents, which I think should have removed zeros there. My apologies, that's just a whole number. Then in terms of those who received, it's a whole number again. And we also indicated on the last row the percentage of those who have accessed the free energy kilowatt hours. So that is what in terms of the question number 1. Question number 2, the high number of refusal, yes, it is concerning. We try to engage several stakeholders. In this case, we have engaged ward councillors. We went to Mamelodi. Some of the councillors have seen them here. We have engaged in terms of this program. We have engaged councillors in Soshanguve and Atteridgeville so that we can make it smoothly. And we are continuing to engage. The challenge that we're experiencing regarding the refusal is being attended to. So I think I will somewhat take the last question of the question that was raised in terms of the targets. If the issues of refusal can be addressed, the target of March 2026 can be met because we have 7,000 installation that is outstanding. If we can iron those issues, we are more likely to attend the target date that we've put. The other one, in terms of the cutoff dates of KRN, that is my apology. It should have been 30 November 2024. I think it was 30 November 2024, which was extended to 31 May last year. That is where the council wrote a report for extension, which was starting from 1st of March up to 31st to allow those people who were not who had breached the meters. So in terms of the next question, the accounts that the prepaid meters without accounts, those are the prepaid meters installed normally in the informal settlements because you look at our subsystems require ERF number to create an account. So they do not have an account of any services. The services are being offered on a prepaid basis. So we normally just create an object to link the meter to vending system. That's why we found that there's accounts that prepaid meter without accounts. I think in terms of the deaths, the high number of deaths, if we have tabulated previously, is one of the issues that's impediment. That is when we want to install the meters, the customers found that their accounts are still in areas. That's why I think in table we try to tabulate the accounts that we found with the debt and say this is a customer who have been approved for amnesty, they are owing so much, it's owing so much. So, and then you know that when we install the prepaid meter, the system is programmed such that if your account is in areas, then it will deduct if you do not have arrangement. Hence we are engaging ward councillors, which I think they've been doing very well. For the customers to go and do arrangement, because arrangement cannot be done by anybody, it's a personal thing that we want to be done. So once they've got arrangement, then they will be able to buy electricity and also pay off their debt that is outstanding. So the other one is the issue of indigents within ESCOM areas. We are processing the invoices. I think we can make them available for the units that we
are those customers who are receiving. So those who are receiving need the matter of being registered, but those who are registered, they should be able to receive the free basic electricity from ESCOM, because on a monthly basis, when we pay ESCOM bill, it does include the free basic for those areas. And then the next question, okay, I already addressed the issue of the March 10, 2026. As I said earlier, if we do deal with issues of impediment or refusal and intimidation, we will meet the targets. I think I've covered all the questions that were raised. Thank you.
All right. Thank you, CFO.
Thank you, Chair. Greetings to yourself and members of the committee. I think I'm just going to address the matter in reference to revenue for corn. From a policy perspective, the reason why we took the incentive scheme to council for approval was to try and demonstrate the benefits that the city would receive. Amongst those, to incentivize clientele who constantly have tampered with the city's systems, resulting in a massive increase in distribution losses. So the incentive was put on board to have a sustainable long-term effect in terms of a new revenue base that the city will have sustainably moving forward. So from policy perspective, we are comfortable with the approvals from council that we don't have any revenue for corn as a result of allowing that process. Similarly, we have, with the new clientele being brought on board, there will be a sustainable revenue base that we brought on board. Similarly, a big reduction in electricity distribution losses. That was the motivation that was put behind the request to have council assist us to waive the fees at this stage. Thanks, Chair.
Right. Thank you very much. As recommended? As recommended? Thank you. Yes, Councillor Zeno?
I don't think they responded my question on areas that are not supplied by ESCOM.
What was the question, if you may repeat it?
I'm saying on the report, Chair, they are saying areas within ESCOM, like that are supplied by ESCOM, like Mabopane, Karangua, Winterveld, and Amaskara, receive their free basic from ESCOM. The question is that, how sure are they? Do they do a follow-up? Because here, they've written this, but what I can tell you, ESCOM doesn't give free electricity to the residents on the other side. So I wanted to check with the city. And remember, I raised this thing in our last meeting to say, residents who are staying on the other side, they don't believe that they benefit from our indigent policy. So I'm asking the department, because it's their report, to say what they've written here, are they sure about it, so that when we go to ESCOM, we must go to ESCOM with facts. Thanks.
So, I'm sure you are much familiar with that side of the ESCOM area. But wouldn't it be better we were able to speak to specific accounts or some sample that extension such and such, here the account numbers, those account numbers have not received. Then you sample it. I mean, the committee, I think, also expressed interest of doing an oversight or inspection in local on certain issues. So we're still waiting for at least that program where we can go and check those meters. It's not a forensic audit, so we're not going to check each and every meter, but it's about just being familiar with whether there is an impact of this thing and whether whatever that is on paper is on the ground. But maybe he will answer, but I think they should prepare for that for us so that we can go in the councillor, like what we did with Royval and so on. We go in on the ground and we go and check some of those issues, because the concerns you are raising are serious. If people are not receiving what we are referring to, but then ESCOM, we have to pay ESCOM and so on. It can't be left unattended. Councillor Mayor?
Just quick response on the answer given to me. I'm not going to be pedantic on the reports that serve before us, but I'm serious about this on the correctness of information. The explanation given to me that this is just a mistake, specifically on the variance that has to be explained. There's space on this page. I believe it was left for the explanation to be given. So I'm not happy with the answer, then I make sure that it come with proper reports to us so that we can see. It seems like something is being hidden. I just want to make that comment. Please, let me get proper reports before us that serve this committee, that we can take proper decisions. Thanks, Chair.
Thank you. Yes, we'll give the department an opportunity to respond. Proceed, Miniar.
Okay. Regarding the ESCOM, I can confirm the people who are registered as indigents within ESCOM areas, they are receiving the free basic. To that effect, I can just confirm that the report between ourselves and ESCOM was signed by the city manager last year as a renewal, because we have a memorandum of understanding between ourselves and ESCOM, and a specific account that have been submitted to receive free basic. So we just have to make a follow-up with ESCOM. Maybe they can just check the accounts which they are receiving the free basic and the one that is registered in our database. Then we can do comparison there. But I can confirm it is happening. Maybe those who are not receiving are those who have not registered, because if you're not registered indigent through our social department, you will not be able to receive free basic there. I think that's it, which I've covered. Thank you.
There's a question from Councillor Mayor. I don't think you touched it at all.
Issue of Councillor Mayor, I don't know. We are not hiding anything. If you have to be honest with the committee, the report was written by Joint Social Department and Electricity. ZN was the comments that Sukisa made comments on group head of Social Department. So when we were writing the report, she put comments. So unfortunately, we couldn't delete the comments. As I said, it is an error from our side. I apologize for that one.
Noted. But we will be in touch just for sampling purposes to check if indeed there is such. As recommended. Thank you. We'll move, colleagues, to report number 3, section 79, Committee, Municipal Public Accounts, Outstanding Report and Process Plan for 2025-2026. The report is on page 64 to 89, with recommendations on page 65. All right. I think earlier on there were comments that were supposed to come from Councillor Semfeng. I don't know if he's still, willing to make those comments. If not a problem, then we can pass the recommendations as they are.
Chair, I think I've been covered. Thank you, Chair.
Thank you. As recommended. Thank you, colleagues. We'll then skip number 4 on the actual agenda. We'll then proceed to the first supplementary agenda. On the first supplementary agenda, colleagues, we've got 4 items. And the 5th item will be entertained in committee. So the first item would be from which is under part 1, report 1. Is from Group Financial Service Department, Greatest Age Analysis as at 30th of April 2025 for the CET. The report is found on page 4 to page 9 with recommendations on page 9. Deliberations? Okay, as recommended. Thank you. We'll go to part 1, report number 2, which is from Group Financial Service Department, Creditors Age Analysis as of 30th of August 2025 for the CT. The report is found on page 10 to page 15. with recommendations on page 15. The report is tabled before you, colleagues. I don't know if there are any comments. I will start with Councillor Senfrey, then Councillor Randa. Oh, and welcome, Councillor Peter. We did receive your apology, but thanks for joining us. The third hand will be from Councillor Mabusela. Councillor Senfrey.
Thank you, Chair. Chair, my question is based on page 12 of the report, specifically what are overdue invoices not paid due to other reasons? What are those other reasons, Chair? Just to get indications for that. Thank you.
Thank you, Chair. Can
Councillor
I
Randa,
continue?
yes, proceed.
Okay, thank you so much. So what we did, because these reports are not new, it's a couple of months old, so we went from the starting point of just comparing the two reports to see any notable changes or alarms that we could pick up. For us, the bottom line in terms of your total trade payables, it jumped from April from 7.5 billion to August on 10.8 billion. So that is noticeable, and that's really a big concern, maybe just to get an indication of, if this could be dealt with, or is there special circumstances that led to this. Then in terms of the annexure, there's the creditors with debit balances. You would have seen that for April, we had a 262 million rand creditors with debit balances. And then it dropped in August to 51.8 million. Also, maybe just to explain, was it overpayment? Was it misposting? Was it an error, an account error that led to incorrect balance? Was there refunds done? So I think those are the two main things, Chair. And then obviously our main concern remains that we're not paying our creditors within 30 days. AXA raised the repeat finding in terms of Section 65(2)(e) of the MFMA. And it's a recurring finding. I know the city financial situation, but really, we really need to try and see. We cannot just sit in the office every morning and decide who are we going to pay, how much are we going to pay. These people, they rely on us to keep their businesses afloat and to keep jobs for their people. So it's really not a good situation to be in if somebody provided a service or a product and you need to wait longer than 30 days, up to 90 days sometimes to get paid. Thank you.
Noted. Councillor Mabusela and then Councillor Peter.
No, thanks, Chair. Just to ask this question, does the city incur interest on the late payments of creditors? Does the city incur interest on the late payments of creditors? I'm asking this question, Chair, because there will be a report that will be dealing with under confidential. And we speak into this one. I want you to understand, if we incur the interest, then how does the city deals with? Because there are some of the creditors who can even take us to court because we did not pay them in time as per MFMA, in particular, is it section 65, subsection 2 and E. So it's non-compliance. And Chair, if you had interacted with some of these creditors or SMMEs, you will understand that some of this delay are deliberate. Allegations are that they are deliberate because they want this SMME to come and inquire about their invoices, and they are going to demand bribe from them. Chair, we need to investigate this. This is a serious matter of non-compliance. One of our responsibility or terms of reference as MPEC is that we need to promote good governance. You can't promote good governance if there is a persistence of non-compliance. In that report, the last report that we are going to deal with, confidential, we are running a risk, Chair, of the national treasury or provincial treasury to also stop transfer of funds into this municipality, be it your equitable shares, grants, because there is a persistence of non-compliance. So we cannot just always say, no, we take cognizant. In fact, we must agree that this need to be investigated to get to the root cause of this persistent delay of payments here. Otherwise, we are going to be found wanting as ever that we are getting this kind of report, but we are just merely taking cognizance of them. Thank you, Chair.
Thank you. Councillor Peter.
Thank you. Firstly, I'm covered by Adriana and Rodney, but I just want to add on to a point Rodney made, which I agree with and I'm very concerned about. Now, firstly, if we go to the report on page 12, we look at the table there between July and August. We look at the percentage column on the side. We can see that due to decimals, it's not adding up. You've got a 98% on overdue, 2% on the second block, and then the third and the fourth, there's also a movement, but it's zero. Now, we need to rectify things like that, and I always get concerned because this gives me an indication that this is a manually generated Excel sheet of which the formulas hasn't been pulled through correctly. And whenever we see manual Excel sheets coming from a system, it raises concerns because Excels can be manipulated. Now, I'm not suggesting it is manipulated, but I tell you what is a major concern for me if I look at this, and this is what Rodney touched, and he was very blunt about it, and I agree with him. But it should be a concern, and I don't know, and I want clarity if we do actually investigate and scrutinize this on a senior level. Because we don't get the H analysis as part of this report, but this, what I'm seeing here and linking to Rodney, gives an indication that certain creditors gets paid all the time and others don't. And if we look at the H analysis, that will tell us that certain creditors, I'm almost convinced about this, if we had to get the H analysis now, will indicate that certain creditors gets paid consistently and others don't. And the question we need to ask, and Rodney is correct, because every cycle, in this case the payment and supply chain cycle, has a risk factor when it comes to fraud and corruption. And the question that we need to ask is, why do certain suppliers consistently get paid and others don't? Why don't we pay according to an H analysis? And I want to know, because we are waiting the outcome of the AG, and we are waiting the report from the AG, but I want to know, do we scrutinize this and do we ask these questions and do we investigate this? Because this is a very, very serious concern. And I can tell you on the ground, the noise being made by suppliers is, they're not getting paid and they're being asked to negotiate, and that's a concern. So, if I can get clarity on that further to Rodney's question. Thank you, Chair.
Thank you. And then we'll conclude the first round. Then CFO, is that you will be responding?
Yes.
Thank you. Proceed.
Thank you, Chair. I think the first question was in reference to invoices that haven't been paid for other reasons and what those other reasons were. It's from our perspective, matters of compliance, administrative compliance, including verification of various invoices and budget matters, have been included in invoice of this nature. Once a commitment is made and it's received, we can't ignore it. We have to capture it accordingly as a payable of the city. However, if there's still a number of outstanding matters from a compliance perspective that are outstanding, we have to put those aside until we can effectively comply with those matters. Hence, we have categorized them under this category. The second issue is in reference to, I think it's debtors with credit balances. This is some of the account holders from our debtor side who have paid the city in advance. Similarly as well, we do have creditors who owe the city as a result of us billing number of clients on the refuse removal perspective. So if we've got service providers who are removing waste to our landfill site, there's a specific charge that we charge to and levy to them as well. When the invoices are due, we then conduct an offsetting exercise on those before we pay them what's due to them. So at this point in time, this was the status quo of that aspect. The next question was on interest on late payments on with creditors. And the answer is yes, we do get charged. However, we are in constant negotiations with various of our creditors, hence we are not being charged any interest. I'll give you an example. The biggest culprits on this, the city would have been charged interest from the power utility, rent, water, pension funds, SARS. Those were the biggest service providers for the city who were charging us interest. Due to our ability to have negotiation and constant communication in terms of payments with them, we're no longer being charged in interest. However, from SARS side, we are paying that on time. It's only the power utility that we have a specific agreement on, and interest have been suppressed accordingly. All other service providers, we are in constant negotiations with them. We have communication that occurs on a regular basis, and there isn't any interest that they're charging us. Any issues of us deliberately withholding payments and treatment of payments of specific service providers, I think this is something that we constantly discourage, and from the information that we have, we pay all service providers in line with the payment system and the AG. We will request that issues of that nature must be raised accordingly. We constantly also advise that through the fraud hotline, these issues must be reported on. We frown upon this extremely, Chair. We have been dealing with many issues of this nature where we're working hand in hand with group audits and rest to try and address them. I think we will advise that some of those service providers who are facing issues of that nature must promptly allocate or escalate these matters to myself and to the fraud hotline so that it can give us the opportunity to deal with these matters without any fear or favor. I think the issue of the percentage, Alderman Sutton, if you look at the numbers, the 710,000 out of 7 billion rand becomes a minor matter. Hence, from a rounding on perspective, it did not make it. So I can assure you the numbers are correct. We have calculated accordingly. 2% it was the 98 million rand as a result of this being significant. The other amounts became almost insignificant, hence we had to have 3 or 4 more decimals below that, hence there was a zero allocated. But I think then in the near future, we can start having decimals attached to the percentage just to give more comfort to our councillors. Thanks, Chair.
No, thank you very much. CFO, I think you've responded to some of the issues. I think I may have 2 hands, Councillor Tsepo and then Councillor Peter. Councillor Tsepo, please proceed.
Yes, thanks a lot, CFO. Mine is just simple. I can see that you're making payments, just that you're making them a week data, meaning that the payments from the previous month will happen in the following month. And in accounting, you can't specify that they're of a previous month. You just have to be equal and just report them on the month that you made payment. Any way that you can fix that and try to improve on that so that your reporting becomes much better? Looking into your administrative, how administration and how things are done, isn't there a way that we can improve in that and try to make sure that at least in the future we have less of that amount, they become reduced, because it's quite a lot of amounts. Maybe explain further, is it a pre-arrangement with who you are paying or what, or is it the timing of payment from the city side, something that the city can control or what? But I can see that payments are made, but it's just that they are made a month later, and that puts you 31 days late, 31 days to get to 31, while you could have kept below 30 days. Thanks a lot.
Councillor Peter.
Chair, the DA will bring this up again later, but I just want to make a point that the fraud line is currently not operational. It's not working, and we will deal with it in a later stage in this meeting as well. Thank you.
Thank you. CFO, if you want to respond to.
Thanks, Chair. I think
And then you will follow CAE. Thank you.
Thanks, Chair. I think firstly, indeed, all payments are by law, within the 30-day period. To shorten that, we are all constantly encouraging user departments as well to try and assist us with submitting all necessary documents within a shorter period of time. We've been able to execute that accordingly on CAPEX-related projects. Within this category, Chair, we pay service providers within a 7-day period. This is escalated as a result of the complexities around CAPEX projects, as we are aware. So it's something that we will be trying to implement as well in OPEX-related projects in the near future. But also, we just need to be aware of the cash flow situation of the city at present, and it can be implemented within the medium term.
Thank you. CAE.
Thanks, Chairperson. I just wanted to respond to Councillor Sutton on the functionality of the fraud hotline. The fraud hotline is working, Chairperson. And the only thing that is not there is that it is not administered by an independent service provider, but the hotline is working and we are receiving calls. We are attending to the calls. Thank you.
Okay. And Councillor Peter.
Chair, thank you. Can I ask that the comments from the official be noted and minuted accordingly as he has stated it now? Thank you, Chair.
They are noted and minuted by the Secretariat. Yeah. I think we've exhausted deliberations, colleagues. But I think my comments, CFO, is, you know, when you sit and you have before us here the creditors' age analysis report as of 30th of April 2025, and we are in 2026 Jan. That for me is a red flag. So I don't want to entertain it at that point, because it was two of the similar reports, just at different points. Then we have one for 31st of August. This report seems to be delayed. And I think if we can improve on that so that we're a bit on par, because there's very little we can do with a report that has aged to that level. Because most probably then you'll find that you've either tried to rectify, then there's a new problem, but the problem is not before us. Then you will submit that old problem as a new problem in the future. So we just consent that we should not be discussing a matter of the previous financial year in a new financial year that is already in its mid-year, as it may. So I think let's just try and tighten it up, and then avoid interest, and then avoid killing small businesses, because essentially, if someone has put their everything in that business and then the money does not come as agreed, then you're causing that business to fail. Then soon that business is not going to be compliant to even apply or bid, because they may be having other problems, whether the accounts with the city are not in order or whatever the problem may be. And then we have other problems now with the service provider. So those are the issues that I think we should strive to work against. It's not about paying the powerful and the big and the mega, and then exclude the small vendors, small service providers who actually depend on the city as payments in order for them to fulfill their other obligations, as it may. So thank you very much. And my team was confirming the fraud hotline is working. And I see someone has picked up. We had to just double check if it's working.
Okay, I understand, sir. And
Thank
with
you.
the
So we are fine, colleagues. As recommended? As recommended? Thank you. Don't minute that. Secretariat will minute that. So don't minute that. We'll then move, colleagues, to report number 3. And the report number 3 is from Group Financial Service Department. Status update on the interdepartmental report as at Q1 ending 30th of September 2025. The report is found on page 16 to page 20 with recommendations on page 20. The report is hereby tabled before you, colleagues. Any inputs? We good. As recommended? Thank you, colleagues. The 4th report on the first supplementary agenda is from Group Financial Services Department, Supply Chain Management Deviation Report on the 2024-2025 financial year. The report is found on page 22 to page 28 with recommendations on page 28. Deliberations. So, your hand is up, Councillor Mayor. Okay, Councillor Mayor, Councillor Tsepo, Councillor Randan. In that order, Councillor Mayor.
Thank you, Chairperson. I just want to take you to the deviation in September 2024. And this is something in general I want to raise. At the bottom of the page, you see for the reasons. This request results in lack of planning and proper monitoring and management of the contract. Now, we've seen this in a lot of deviations. A lot of cases, we talk about proper planning. Have we, I've seen it the past couple of years already. Is there something in place where we do proper planning? It's about project planning, etc. This one is not specifically, I think, about project planning, but in general, it's proper planning, proper monitoring and management of the contract. Could be management of a project as well. This is just in general. We see this as a reason for deviations and whatever, and is there a plan in place that we can do proper planning? We can't carry on like this. Thanks.
Thank you, Councillor Mayor. Councillor Tsepo.
Thanks a lot, Chairperson. He has covered me a lot. All these deviations, they are all mostly irregular. It's just contract management. The contract expired, it was extended, and the next thing we'll have to have this pile up of consequence management, irregular expenditures, investigation. We're wasting money on investigation. I think accountability has to go somewhere, be redirected in some way, because we'll be putting punitive measures on the BAC or what. Who's in charge of this contract management? Maybe we need to find out today, Chairperson. Or who navigates when this thing starts and ends, and who's in control of that? Maybe that we need to have accountability of that. Now we are working overtime. We have to read all these reports all the time. The next thing, all these things will be flagged by the Auditor General. The next thing they have to go for investigation is money. The next thing we have to read those reports is time. And sometimes, I don't know, what is so bad about just saying this contract is about to end in 6 months? Can we have systems in place? Are we leaving to the basic to decide that they postpone for the whole 3 years or 5 years until they are appointed? We are not ready. Mama did not meet requirements. Who steps in when all those things happen? Who accounts when things are at that level? And I think we need to start asking those questions, because our names as impact members are part of the AG's report. It's like we are failures at the end of the day. When we have adverse, it's sepokashe, adverse. No, Chairperson. I think now we need to start moving and start correcting all these things. They've been happening. It's a norm now that we just deviate, and it's fine. The Auditor General will flag it, and then we'll come back, we'll write it off, and it's okay. And business as usual. Thanks a lot, Chair.
Thank you, Councillor Tshepo. Councillor Runda.
Yes, Chairperson, mine is a quick one. It is a summary of what we've dealt with last year. If I look at the pyramid fire, the coastal guard, etc., for the lifeguards, I wanted to still go and check whether each and every one had indeed served in council, and we adopted these items. Maybe if we can just get the assurance that it indeed happened. Otherwise, I will just go back and assure myself that each and every one did serve in council and it was adopted. Thank you.
Thank you. CFO, I don't know if it's CM or CFO in this one. CFO, yes?
Thank you, Chair. Indeed, I think these are some of the deficiencies that the city faced almost 2 financial years ago. Poor planning was something that we were dealing with in a right manner. There has been some significant improvement of late, but I think I can also confirm, Chair, that we do send quarterly reports from supply chain management to council. So this is for the 24-25 financial year. Bulk of these have indeed served at the relevant structures of council. Chair, further to this as well, there are some deviations that do meet the requirements of the law, for argument's sake. The last one, which dealt with specialized training for group audit and risk, as well as, I think it's deviation number 3, let me just confirm, but there is another one. So some of them do, yes, number 2, they do meet the requirements of a deviation. However, when we scrutinize and see an element of poor planning, we have to be honest to ourselves. We don't wait for the AG to tell us that this deviation did not comply with the ambits of the law, hence should be disclosed as irregular. The city systems have been configured in a manner that we are honest to ourselves, we keep ourselves accountable, and once a deviation is approved, for whatever reasons that might be brought on board, not to alleviate or deviate on service delivery, we then direct them accordingly for compliance with Section 32. But I think of late there has been some improvement in terms of lessening the number of deviations. We have been also putting systems to hold each other accountable. Working with a number of the group heads, we've scheduled a number of training exercises, for argument's sake, that we've committed to National Treasury on how we're going to deal with UIFW as a balance on its whole. We'll be having several training engagements with various groups to improve on planning. From a supply chain management and demand management perspective, regular communications are issued to various of the colleagues across the city. We have seen an improvement in terms of submission of specifications of time, ensuring that the procurement process are dealt with. We are still facing issues where certain programs are not finalized at a particular time frame, hence we need to continue with extensions or deviations. But Chair, it has been less than what we've been seeing in the previous financial years, but it is something that we continue to monitor and trying to put systems in place to deal with them.
Yeah, so we are worried, because as much as the CFO is responding to some of these issues, a lot of these would fall under the CM. We've been trying by all means, because we need to reduce the deviations, the amounts that are contained, as it may. We are struggling to get that number down, but then it makes us as a community to look like we're not effective. There's supposed to be a flagging system. People should know. You should appoint the proper people. The MBD forms must be in order. the Bid Adjudication Committee and all the people that you are appointing under you as the accounting officer. Things need to be done properly. That's all that we're asking for, because the more these things happen, the more then we're going to end up contradicting each other, and it comes across as if there's concerted effort to oppose or fight certain people. But there are certain things here that are contained on this report that shows that structurally there are big problems. And I think that needs to be addressed this year. The irregular expenditure is growing. There are letters here that are coming, and an impression is created that the problem is sitting with the committee. But there is somewhere where the problems have been generated actively. And it cannot be business as usual. So I would like to request that you strongly look into mitigating this kind of issue, so we don't have that at all before we start chasing the targets as it may. Now, I don't know the feel of the committee, if you're comfortable with the recommendations that are here on this report. And if you are, then we should then proceed.
Chairperson?
Yes,
I think
yes, Councillor.
the coming reports are going to assist us with this one. No problem. Let's just leave it for now. Thanks a lot.
Okay. Are you comfortable? As recommended? Thank you. So we'll jump the second supplementary, and then we'll go to a third supplementary. On the third supplementary agenda, this report is from the Office of the Speaker, is the Municipal Public Accounts Committee Midterm Performance Report for the period 1 July 2025 to 30 December 2025. The report is found on page 4 to page 85, with recommendations on page 13. The report is hereby tabled before you, colleagues. Any inputs? Earlier on, Councillor Mabusela was hinting that he can't wait to entertain this report. I'm kidding. I'm kidding. He meant the one on terms of reference. Yes, no, wait, let's start with Councillor Mayor. Councillor Mayor?
Thank you, Chairperson. If you look at the report on the financial, it says we've got a lack of budget allocation, obviously which impedes on our operational efficacy. But I think if we get to the first supplementary report where we look at our terms of reference, I think we're making progress there. Just a general comment on that, because I think we need to get more teeth and we need to get some money for that. It was on the table before at this committee, but hopefully we will overcome this burden as well. Thank you.
there another hand? Councillor Mabusela?
Well, you know, we are scrutiny. Is the third supplementary, this one? It's in relation to our performance as MPEP, if I'm not mistaken. So, we are noting the report, we take cognizant, we just wanted to, at least there is improvement. We can see that in terms of UIWF, how many did we process, how many did we return back. But if you read page number 3, in terms of 4.3, we were just maybe saying we need an improvement when we deal with in-year reports of the municipality and the entities, section 71. We only dealt with 2 last semester, last 6 months. And these are the, the monthly reports. So 2 out of, we had how many meetings? 6 or 5. So we need just to improve around it, Chair. Thank you.
Yeah, no, thank you. Okay, no, thank you, colleagues. As recommended. Thank you. Right. Thank you, colleagues. I think we'll then now entertain calling of reports. Okay. Councillor Randall.
Yes, thank you so much, Chair. Today I'm calling for a report on the City of Tshwane's anti-fraud and corruption hotline, the 080 number, as well as the fraud@tshwane.gov.za. My motivation is that an effective anti-fraud and corruption hotline is crucial for the City of Tshwane, as it promotes transparency by encouraging residents to report suspicious activities, fostering trust and accountability, and it deters corruption as it signals that fraud won't be tolerated. It protects public funds as it's demonstrating commitment to clean governance and responsiveness to citizens' concerns. What must be reported on? I've got 6 specific questions that I'm asking in the report. Just quickly as to how many forensic investigations stem from the information received via the anti-fraud and corruption hotline. Please include a breakdown for the number of disciplinary actions, criminal referrals, and financial recoveries for the past 3 financial years. Provide a detailed description of the number of dismissals and final written warnings. Please provide the top 5 reasons why residents have been contacting the hotline and what interventions stem from that. Indicate current system challenges with the hotline, as many complaints have been received that the hotline is not functioning. Please include instances of downtime experienced with solutions suggested. 5, please explain the hotline's operational details, including whether it's contracted to an external service provider or it's done on-site or in-house. And please indicate the workforce allocated, and finally indicate allocated budget for the current financial year to ensure effective functioning of the hotline. Who must report internal audit and risk, according to my knowledge, and why is the report necessary? And I'm just going to take you back to my motivation and just ask that this report be considered. It's proposed by myself, Councillor Randall, seconded by Councillor Mabusela, dated today. Thank you.
Thank you, Councillor Randall. The Secretary will assist us with the calling of the report. collection thereof for it. Thank you very much. I have here with me the calling of report. I'll read the subject of that, which is the City of Tshwane's Anti-Fraud and Corruption Hotline, 080-874-9263, stroke email address being fraud@tshwane.gov.za. The report is called by Councillor A.M. Randall and seconded by Councillor Rodney Mabusela, dated 16th of January 2026. Thank you. The report has been called. Right. Is there any other report? Right. Thank you very much, colleagues. Colleagues, the next part of this meeting will be in committee. So we'll excuse all the officials that are not necessarily required to form part of that meeting. And we'd like to thank you for coming through. We wish you a prosperous and fruitful year ahead. Thank you very much for honoring this meeting. I appreciate it. We'll switch off streaming as well. Thank you.